Comparison between a rotatable sphincterotome and a conventional sphincterotome for selective bile duct cannulation. Introduction. Endoscopic retrograde cholangiopancreatography, ERCP, is an indispensable procedure for pancreaticobiliary disorders, not only for therapeutic aims but also as a diagnostic tool. ERCP is, however, a technically challenging procedure with a high adverse event rate, up to 10%. It is difficult to educate trainees in its performance because there is little time to spare during the procedure. The first challenge for trainees is selective biliary cannulation, SBC. To improve their SBC rate, trainees need experience with many cases, but at the same time, involving trainees should be avoided to reduce the risk of adverse events, which thereby creates a dilemma. Some studies have reported the efficacy of an ERCP mechanical simulator, EMS, to overcome this problem. The availability of an EMS is not widespread, however, even among educational institutions in Japan. In hospitals in which there is no EMS, novice trainees must sometimes depend on verbal cues from the expert to more quickly determine the appropriate directional aim toward the bile duct. Novice trainees often have difficulty positioning the scope against the papilla vater and appreciating the alignment of the catheter with the bile duct axis. These conditions make SBC difficult. A rotating sphincterotome with the ability to change the orientation of the tip in relation to the papilla, which is often used in patients with altered anatomy such as a prior Billroth II anastomosis, may help to guide the directional axis of the scope and has been used to perform wire-guided cannulation. Although the rotating tip may help the novice endoscopist to cannulate the desired duct, its usefulness has not been evaluated. Therefore, in this study, the authors evaluated the efficacy of a rotatable sphincterotome compared with a conventional sphincterotome for SBC performed by beginners. Background. Selective biliary cannulation, SBC, is the first challenge of endoscopic retrograde cholangiopancreatography, ERCP, especially for trainees, and a rotatable sphincterotome may be useful to guide the directional axis of the scope and SBC. Methods. Kurita et al. Performed a prospective, randomized, single-center trial enrolling 200 patients with a native papilla who required therapeutic biliary ERCP. Patients were randomly assigned to the rotatable sphincterotome group, N equal 100, or the conventional sphincterotome group, N equal 100. The primary endpoint was successful SBC by the trainees within 10 minutes. Results. The early and late cannulation success rates did not differ significantly between the groups, P equals 0.46 and P greater than 0.99, respectively. For the patients in whom trainees failed to achieve SBC, the rotatable sphincterotome was used as a rescue cannulation technique in 4 patients from the conventional group. In no patients in the rotatable group was the conventional sphincterotome used for SBC. Post-ERCP pancreatitis, PEP, occurred in 11 patients, 5.5%, 6 mild, 5 moderate. The incidence did not differ significantly between the two groups. Rotatable group 3%, conventional group 8%, P equals 0.21. The two groups were thus combined for evaluation of the factors relating to cannulation difficulty for trainees, which revealed that orientation of the papilla was a significant factor, P less than 0.001. Conclusions. The type of sphincterotome used did not affect the success of SBC by trainees. However, orientation of the papilla was revealed to be a significant factor relating to cannulation difficulty for trainees overall.